Leaders Roundtable. We are dealing with a government in the province of Ontario that wants to aggressively move forward with privatization. And neighbors have gotten in touch with us, with Chandra, with me, with Ed, saying, how do we push back? Well, for the next hour, you're going to hear about movement already underway, momentum already happening in our city to take on Doug Ford's attempt to privatize elements of our cherished public healthcare system. But before we get any further, I want to make sure we start in a good way by acknowledging that this meeting is happening on the unceded and unsurrendered territory of the Algonquin and Anishinaabe peoples, and we are very thankful for their friendship, their stewardship of this land for thousands of years. And we hope that our meeting today, our organizing today to save what matters to us, to keep us well, to keep us healthy, to respect the people working in the system, patients want to use the system, is in keeping with the spirit of reconciliation. So just to give people a sense of what they can expect for the next hour, we are blessed, very fortunate to have with us leaders from our local healthcare sector here who are going to talk to us a bit about what the status quo looks like right now in healthcare. And then you're going to have an opportunity to understand where this push for private clinics comes from and why Ottawa has been chosen, particularly to be a lead experiment for having private clinics performing surgeries that had been done previously in the public sector, continue to be done. And then we're going to switch to more of an update and organizing mode to let you know how you can plug in, how you can attend events that are coming very soon, and how you can get neighbors, friends involved. Okay, so that's a bit of an expectation. Why don't we begin with a roundtable of who's here, and being very thankful for who's here. Amy Roberts, you are here from the Ontario Nurses Union, Local 083, the Ottawa Hospital. Amy, I'm wondering if you could just help us understand, what are you hearing from members in this moment? We hear the hero word thrown around a lot, nurses, but it would be great for us to understand, from your perspective, what's the mood like now in healthcare with the folks you work with all the time?
Thanks, Joel. So I work with Local 83 out of the Ottawa Hospital, and have been a nurse for many years, over 25 years, and really have seen a change in the experience of healthcare. As everybody knows, it's been in hospital. We're facing a real crisis with our aging population. Our patients are sicker. People don't have, and I know I go over this a lot, but I just feel like it's a message that has to get out there. People don't have family doctors.
Yeah.
They don't want to go to the hospital if they're sick, but sometimes there's no other option. For nurses on the front lines, there's so many issues in terms of, short staffing. So, when a nurse goes into work, often, like one example is often a unit can be short 3 staff and another unit is equivalent in staff. So, what's the option? Well, we'll pull some nurses from that unit that's even staffed, which is, able to maintain an adequate level of care. We're going to move those nurses to, we're going to split them up, which is incredibly stressful for the nurses on the front lines, because often they're going to units that they don't know the patients. It might not be their specialty, and they have no choice to refuse. And as a regulated profession with a license to protect, that can be incredibly stressful, because you want to make sure you're making the right decisions. We're also losing experienced nurses, and we have a lot of new nurses coming into the profession, but without those mentors, available, that's a huge resource to be losing. Nurses aren't getting vacation. There's, sorry, I'm just, don't want to miss anything. Basically, the impact of all these things on patient care is you need to prioritize. So when resources are limited, what's the minimum standard that we can provide? And that's not a situation that anybody wants to be in. And understandably, the public is frustrated and angry when they have to go to the hospital, and we're also seeing the brunt of that. Ontario's already 24,000 nurses short, so privatization is not the solution to this problem. Nurses and other healthcare workers are just going to be poached by clinics that offer better hours and better pay to these other sites. I think of Doug Ford saying, we're going to open the doors of Ontario to nurses and to come, work here. And I don't know who he's referring to, but given Bill 124 and the conditions for nurses right now, I can't imagine they're going to come rushing to Ontario. And also, privatization, basically, it serves the population that can afford to pay for surgery. As you said, it's not free. And it just brings to mind, the situation where with COVID, where we had, a couple rented a plane to travel up to the Yukon and get their COVID vaccine, and everybody was outraged. And I think, this is a similar, what value do we place on access to healthcare? And it should be universal and equitable for everybody in the province. And I could go on. I don't want to talk too long.
No, I mean, it's brilliant. And when you hear the Premier saying things like, Premier Ford saying things like, well, we are committed to our health human resource strategy. We're trying to encourage people to get through nursing school. We're inviting nurses from all over the country to come to Ontario. But we know the government not only has implemented Bill 124, they're appealing a court ruling that struck 124 down. What are you hearing from nurses?
Nurses are outraged. All I can tell you is, unfortunately, nurses can't strike. If they could strike, they would. Right. But we have to be there on the front lines. And talk about being empty lip service, your heroes. But I just think we're at a breaking point, and the system is at a breaking point, and we can't sustain this. So, if you haven't been in a hospital recently, you may not see the issue, but for anybody that's been in a hospital and either been a patient or had a family member in the hospital, you really see the impact on the quality of care. There's a lot of frustration out there. And you'll see it with the upcoming actions from the nurses union, and we're trying to look at different strategies, because our strategies in the past haven't been effective enough, because obviously the government is not listening. So we really need the public. We really need the public and other unions to get on side and support us in this.
Thank you so much. I'm going to pass to Chandra if you want to bring in our friend Dave, who's also coming from a nursing perspective, different folks, but over to you, Chandra.
Thanks, Joel. Dave, it really struck a chord with me when I heard Amy talking about nurses and the discomfort and the challenge they're being asked to take on of providing care in areas where they're not qualified. We know Bill 124 has been a huge source of disrespect, but so have the working conditions that nurses have been asked to work in for the past 3 years, and really more, because we know that the challenges in our healthcare system didn't just start with the pandemic. And that's really one of the challenges with the privatized healthcare here, that we're setting up a scenario where the public healthcare system has really difficult and damaging working conditions for our nurses. And then the private for-profit system can offer them more wages, but also really different working conditions. So can you talk a little bit about what that experience of working conditions has been like, and the risk that this privatization creates in drawing more nurses and healthcare workers out of our public system, and what that will mean for patients?
Thank you, Chandra. Yeah, absolutely. And just to reiterate what Amy said, I mean, she hit the nail on the head. There's so many pressures going on inside our hospitals right now. We are in a human resources crisis. In my new role as first vice president for OCHU, I traveled around the province this summer, and with our crack researcher Doug Allen here at CUPE, he broke down the numbers and talked about the vacancies that hospitals are facing. And in total, we're at 47,000 healthcare workers short in our system as of today. We are seeing turnover rates of 15% per year. These turnover rates we've never seen before. Pre-pandemic, we were half that. But in my travels, I got to talk to a lot of healthcare workers, hundreds of them across the province, and it's the same messaging. We're burnt out, we're demoralized. Heartbreaking stories of people breaking down in their cars after their shifts, even before their shifts, because they just know what they're walking into is staffing shortages that, as Amy said, you're trying to do the best job you can, but very often you're trying to do just the most important things to not have a patient being neglected during your shift. It's heartbreaking. This private system, if it draws more workers out of our public system, it's just going to create even more hardship. I'm really happy to be here today to echo my thoughts. I've devoted 35 years of my career to healthcare. I'm an RPN at Briere Hospital as well. And yeah, I really think we're going down a road that, we have to push back against this government.
Right. And CUPE and OCHU have done some important research on the risks of privatization and the impact on patients. Can you talk a little bit more about that?
Yeah, absolutely. So it was quite amazing to find out that, as I did my tour this summer, very often I would wait to see what the government's response was going to be. And either it was no comment. Initially, I think the health minister said everything's normal here, as dozens upon dozens of ERs were being closed on a regular basis. We were hearing it all across the province. And then we find out later on that there was $800 million that was unspent, budgeted money to go to healthcare that was unspent. And as I was doing my tour, I would often say, why are we in this situation? And I think, given the recent developments, clearly we know the answer to that. Is this was a prescribed course of action, an ideology that was to drive, a public closing of a public system, or pressures on a public system, and really opening up the privatization piece.
Yeah, and that's an important point that you make there, that what's really maddening about this isn't a shortage of resources or shortage of solutions. Nurses and healthcare workers, CUPE and OCHU, have been incredibly clear about what the solutions are to shore up our public healthcare system. It's not like the choice is status quo or Doug Ford's privatization agenda. We know what the solutions are. We have the money. It's a choice of not implementing those solutions and choosing to drive profits into the pockets of people who have lobbied the government rather than investing in that public healthcare system. Back over to you, Joel.
Okay. Ed, actually, I'm going to throw to you if you don't mind, because the Health Coalition works with all people who are passionate about healthcare, with staff, with patients, with community members. And we have David with us today, who attended our January 19th. Nice to see you, David. Our January 19th action, where we actually toured 2 private clinics. So I'm just going to pass to you, maybe to have a conversation with David, so we can understand from a patient perspective the privatization that already exists. What I'm hearing from Amy and from Dave, like we were already in the grips of this. So pass you over to you, Ed. Thank you, Ed, by the way, for all the organizing Health Coalition's doing.
Thank you, Joel. And I want to thank David for being here today, because we need to dispel this myth that this is just about unions. It's not. It's not about politics. It's about the healthcare that people in our communities deserve. So David, tell us what situation you've been through recently. Share, if you don't mind sharing with the group.
Yeah, absolutely. And that's kind of what I saw too. There's not a lot of people coming out about their stories. And obviously that's because maybe a lot of people are worried about that. But I just felt ready to come out with my story about my health scare and what this means to everybody, because ultimately everybody eventually has health problems. I have to wear sunglasses due to my condition. It'll show my face. So I'm just on disability leave now. And in June, I just started sleeping more and more, and I was trying to get diagnosed for what was going on. I won't go into too much detail, but basically it kept going on until October, and then I started losing feeling in my hands, feet, and face. And I had been seeing a doctor, my family doctor. I'm lucky enough to have one, and they were performing all the tests, but it only really became quite severe in October, of course, with these symptoms. And I went to the hospital 3 times because I needed an MRI. And I was basically told that I would not be able to get an MRI unless I became paralyzed, and from basically like completely paralyzed, which is really traumatizing to hear when you're already sort of losing more and more feeling. And I went back 3 times, and eventually I just begged and pleaded for an MRI, still couldn't get it. And I had to wait about 2 weeks. It was not bad to see a neurologist. Then they told me we still can't really give you one because there's just not the resources. and all the healthcare workers I work with were great, no criticism there. It's just that there's not enough resources. And so I had to go to Quebec because to pay for one, I paid $4,000. And kind of imagine what mentally you're going through at that point. And you're also losing your ability to work and earn money. And it's another thing that people need to take in consideration is that when you're going on disability, you also need to have all these notes taken down. And if you can't even see a doctor, you can't get notes. So you can't get medical EI, you can't get your disability leave at work. And so this shortage isn't really just about wait times anymore. It's really about people falling through the cracks. And it's going to be it is currently devastating, and it's going to continue to be really devastating until there's no longer a policy of deliberate neglect of the public healthcare system. And the cost is going to be much higher than the healthcare system. And if we go into privatization, all that, the cost of potentially more people on the streets who can't provide for themselves anymore, who can't work anymore, who maybe don't have the capacity or willingness to kind of go through all that whole system and advocate for themselves as I did, to try to force the issue to get the treatment. And it's just really scary. I kind of came out from this and I felt like I just got through it. Luckily, I got treatment, and it's not going to be too bad. I should be fine by the summer. But it's just really scary to me that think that I consider myself someone who's very I'm able to advocate for myself, and I feel like I still just pass through by the skin of my teeth. Mm-hmm. And I'm really scared for people who aren't able to do that, or maybe they can't do that, or maybe they're getting judged or something like that. And it's really scary for me to think about. So I don't know. I get emotional when I talk about it, but that's the real impact. And it's not just you; it's your loved one, it's your employees. There's going to be a way higher cost to this than just wait times, and not to mention all the impact on healthcare workers.
Thank you, David, for bringing a patient's perspective to all this, and we want to wish you well in your recovery.
Thank you.
So, David, thank you for being with us and for having the courage to tell your story publicly. I know Chandra and I are hearing from families and from people who are going through exactly what you're talking about, and this is going to offer some opportunity for people to reflect on the problems we had long before this latest experiment the government's embarking on. So, Melissa, that's a good segue to you, because Melissa Conrad, you are a union leader for OPSU. You work as a lab technician. You've seen the public and private sectors working alongside each other. Could you tell that story for people who don't know? Well, first of all, we should bloody well know how important lab techs were during the pandemic to get tests processed and information back. But can you help us understand, help the people who are tuning in here understand, what you've seen in privatization and some of the costs?
Yeah, so I can tell you, I've been a lab tech at the Ottawa Hospital for 20 years, and it was fully operated by the hospital, paid for by the hospital, until about 10 years ago. They decided that the lab structure within the hospital was a large part of the budget, and they wanted to take it out of the hospital funding and put it into private, not-for-profit. So although the government did give startup costs to the organization, and I will back this up just a little bit, they modeled it after a structure that they put in place in Alberta that collapsed within 2 years. And Ontario said, well, let's do that anyways. We can make it work. We can do it better. And what happened there is they privatized all the labs. They realized it was too expensive for a private company to run, and the company walked away. And so all these staff members were then, the hospitals were scrambling to bring them back onto salary. It was one of my colleagues was there when it happened. It apparently was very chaotic. So they did it here and created the Eastern Ontario Regional Laboratory Association. They put 18 hospitals under this umbrella, and we are now private, not-for-profit, working within the hospitals. And some of the smaller hospitals that we had decided it was too expensive and said, we don't want your contract, and went to a Life Labs, then realized that Life Labs didn't offer all the services a hospital needed for the complex diagnostics that are provided, and then had to re-engage in a contract with our company to have services rendered. So hospitals that are trying to save money are learning the hard way that it's not always the best. And I know we've talked a lot about private for-profit companies or even private not-for-profit companies wanting the non-complex cases, the non-complex diagnostics, the ones they can make money off of, leaving the hospitals with the more complicated, more expensive diagnostics, right? PCR, for example, which is what we did for COVID, is quite expensive per test, which is why a lot of the private facilities said, yeah, the government's going to give us money, we're going to run this, very quickly dropped off as a testing site because of the cost. I did work in the COVID lab during the pandemic, and when the premier said, don't worry, we're going to have shoppers start doing their own testing, I reached out and said, okay, hold on, like, we are a regulated profession and we have to have an accredited license every so many years that our lab has to prove that we're adhering to the highest of standards, or we don't get relicensed. How are you just throwing the ball over to a private for-profit company? Are they going to have these evaluations? Who's going to be checking the quality control? How do we know that these tests are reliable? Who's running them? Interestingly enough, on Instagram or on LinkedIn, someone from one of these private clinics reached out and said, hey, would you like a job? We were looking for someone to run this. I'm like, are you kidding me? Although I did ask them a whole bunch of questions, which they couldn't answer. You know, who's going to be regulating you? Who's setting up your equipment? When was it registered? You know, all these things. Oh, we were hoping you might want to do that. So they literally had an analyzer dropped off and they were looking for someone to run it. I was shocked. I told them absolutely no, that I wasn't going to put myself at risk like that. But clearly they found somebody. And when it wasn't working out, they started shipping this testing for travel off to California. So we were paying for that. Our government was paying for that, but the premier was branding it as not burdening the system with this travel testing. But that's why people were paying $100 a test, is because it was being packaged up and shipped off to a facility in California to not burden Ontario's system instead of further investing into Ontario's system. So they brand it pretty when behind the scenes, it's quite scary what they're allowing with lack of regulation. So it was interesting to see from the inside. It was frustrating to hear the premier stand up and say, I don't understand why these lab staff can't just do their job. So it was soon after that that I got the ear of some reporters and wrote a nice article about the reality from the inside of what it was actually like. You know, when we'd get 11,000 samples in a day and the government was really only equipping us to run 5,000 samples a day. They purchased an analyzer and said, we've set you up, but they didn't sign a contract for all of the reagents required. So this analyzer should have ran 12,000 samples a day, and we only had enough testing reagents to run 5,000 a day. And then they blamed us for the problem. So from the inside, it was very frustrating, and people were leaving at a very high rate. So they started hiring non-lab trained personnel. They started hiring people who had a degree in science that had never worked in a lab maybe, but they had a piece of paper that made them feel like we can hire this person and train them. But it's not really that simple. So from a colleague to colleague perspective, tensions were high because we needed the help, but we were training and putting our licenses on the line, training someone who really didn't have the background to do the job. So it was it just reminded me that there really are no lengths that this government won't go to look good on the outside. But on the inside, it's been quite frantic, to be honest.
Wow. And lots of money for Life Labs and Shoppers Drug Mart. Chandra, I'm going to throw back to you because we are blessed to have Adrian Silnicki with us, who's not only leading research at CUPE National, but spent a long time as a healthcare campaigner, because I think we would benefit for a little bit from some perspective of where this privatization push comes from. Back to you, Chandra.
Thanks, Joel, and welcome, Adrian, who I have the good fortune of knowing well as a former colleague, in addition to as the current director of research at CUPE. And, you know, one thing that really jumped out to me in Melissa's history of what happened, which was fascinating. I didn't know all of that history, but, you know, the presence of Shoppers Drug Mart, because on the one hand, Doug Ford wasn't giving the public system what they needed. On the other, he gave Shoppers Drug Mart this huge lucrative opportunity. And, you know, spoiler alert, Shoppers Drug Mart is a name that comes up quite frequently with the government because there's certainly a strong lobbying campaign happening. And we know that lobbying campaigns work with this premier. But Adrian, can you give us a little bit more of the history of this push for privatization and what is driving it in Ontario?
Yeah, it'd be my pleasure. Thanks, Chandra. And it's nice to see you always. And in this forum is fun too. And, you know, what Melissa was saying and the tie-in with Shoppers sounds a lot like Herzig as well. You know, it's not just lobbying, it's money. People who donate to the Conservatives seem to all of a sudden get these lucrative deals. So we're seeing this play out again. But you know, it's kind of, there must be a German word for like a tragic laugh that you have. But I feel like every time I hear the, you know, that privatization or the profitization of our healthcare system is somehow an innovation, I want to have this tragic laugh, because we've had that. We've had that for a long time. That was the start of our healthcare system. You know, we had certainly charities and we had for-profit. And we managed, the Canadian public stood up and fought hard, you know, under Duhamel Douglas, and we created this public healthcare system so that we didn't have to rely on what you had in your pocket to pay for the healthcare services that you need. And yet here we are seeing this again coming back. We're going back to that privatization, to the profit making off of these essential healthcare services. And one of the other things that I'm hearing a lot from the Conservative government right now is that, you know, this is a solution, this is an innovation to the problem of wait times, especially in ORs. Mm-hmm. And I really want to quickly dispel that myth. I have in front of me 3 Auditor General of Ontario reports, 2006, 2009, 2021, that are all saying that operating rooms are actually free and available. In fact, 30% of the time, there is nobody in them. They're not being cleaned. They're not being prepped. They're not being serviced. There's nobody there. Patients aren't getting access to them. Wait times are growing. And if you look at these Auditor General reports, if you look at reports from the Canadian Institute of Health Information, we call it CIHI from 2015, they had a separate report. They found the same thing, 30 to 35% of the time during the weekdays. This isn't weekends. This isn't after hours. This is between 7 a.m. and 4 p.m., Monday to Friday. Operating rooms are not being used. And every time when they try to solve it, they're saying it's staff shortages. It's what we're hearing from others on this call. Amy, Dave, they all touched on it. It's a lack of resources. It's not having the people there. And so creating this 2-tiered system where we're offering this second private system doesn't solve the staff shortage. In fact, it makes it worse. And we have lots of information on that too. We have lots of evidence of that. Even here in Ottawa, we have one. You know, at the University of Ottawa, we see, or the Ottawa Hospital, sorry, Dr. Begg, who is a cornea surgeon. He has some of the longest wait times at the hospital, and he has a private practice. You know, we see people who are working in both the public system and the private system having very long wait times in the public system. In Quebec, this has been happening for a long time, and there's a case that was going to court because there were reports of physicians artificially lengthening their wait times in the public system to expedite people into the private system. You have to prove the wait times are too long in order to put them into a for-profit system where you make money. And so we are seeing reports of physicians lengthening these wait times in the public system so they could see people quickly and make more of a profit. They can charge more for it. So none of this is new. Nothing's new under the sun. This idea of this being innovative isn't innovative. And, I will say that there are also some solutions in what we are seeing. Standalone clinics have proven to work. So standalone hernia clinics like Shouldice and others do see more patients faster. And it's because the method is actually quite good, right? You're doing one surgery, you're doing it fast, you've got a team of people, and you can get people through pretty quickly. There is absolutely no reason the public system couldn't do that. They can do that. We just have to invest in it. And instead of putting money into profits, we put money into patients. And for some reason, that's not innovative.
Yeah, absolutely. We just know every time Sylvia Jones uses the word innovative, what that is code language for. But one of the things that Sylvia Jones, the health minister, also said when they made this announcement was, don't worry, we're going to have the private clinics come up with a staffing plan when we approve them. Can you talk about why that's not actually a solution to this challenge of the private for-profit system drawing healthcare workers out of the public system?
Yeah, you've heard it on the call already. We don't have enough healthcare workers. And we have seen where private hospitals have been set up or for-profit clinics have been set up, and this has happened already in Ontario, they already exist. We have actually seen people go into the hospitals talking to healthcare workers, trying to extract them. Melissa has a LinkedIn example of that. And we've seen in some places where surgeries have been canceled because they lose their anesthesiologists. We don't have enough of them in the province. And so when we lose one from a hospital, the only option is to cancel surgeries that people have been waiting a very long time to have. And the private clinics will offer staff shorter hours. Staff need shorter hours. I will be the first to say that. We need more staff. They're overworked. They're overburdened. They need shorter hours. But putting them in a private system, capping the number of people they see per day, and then having the public system with less staff and now longer wait times is certainly no solution. So there's, the staffing shortage is a crisis. It is a problem that we need to solve. We do need to, offer all kinds of options. And there are all kinds of solutions out there. And we've seen some of those of like team-based models. Instead of relying on having one surgeon be the only person who's responsible for a patient, have a team of surgeons. So if somebody's off one day, another person can do it. Going back to operating rooms, we see them shut down sometimes for 9 weeks in the summer because there aren't enough staff. We need to bring staff back into the system and have them take people through so that in the summer, we're keeping the operating rooms open. But team-based solutions isn't new. It's something that's been practiced for a long time. And it's been practiced in the public system. In Ottawa, we're blessed with a lot of community health centers where we see people like nurse practitioners taking on roles that in other places only GPs are allowed to do. If we have these teams of people, we can better care for people, and it actually creates an ability for more patients to be seen and more care to be provided. It's not brand new. It just requires an investment, and that's what we're seeing the Tory government not wanting to do.
Right, some actual imagination in how we approach healthcare. Right. One of the things that we haven't discussed yet in this call is the funding impacts on public healthcare. So we have talked about how the privatized healthcare will draw staff out of the public system, but we haven't talked about how it will actually affect the bottom line of our publicly funded hospitals. Can you talk about that?
Yeah, and the big one there is cherry picking. So we see in, public hospitals, anybody who needs care goes, and we create a triage. Those who need care quickly get to go first. And in Dave's example, not quickly enough for sure. But the private clinics are not, then the for-profit clinics are not set up to actually provide for complicated, complex patients. So if you have multiple needs, if you have lots of risk, the private for-profit clinics don't want you. You're expensive. You take a lot of time. You take a lot of resources. So they choose the patients who are healthy and wealthy, who can get through the system quickly. We have the Ontario Health Coalition, a big shout out to them. They do some incredible work, and they've done amazing reports. And a report a few years ago, they called over 160 private clinics across Canada, and they posed as patients. They asked them questions. If I go there, can I get an MRI today? How much will it cost me? Do I need a physician to sign a form saying that I require this? And they were able in all kinds of cases to be told, no, just come on in. Yeah, it'll cost you, $1,000. We'll get it done today. No problem. Then you can go back to the public system with your note. And so we have seen this time and time again. And we know that's one way that they're doing this, but they will only take, when they're asking them these questions to bring people in, they'll only take the healthy, they'll only take the wealthy, and they'll ask them things like, if you get this procedure done, we're really recommending this extra lens. It's a super special lens that you really need. It's foldable. It'll only cost you $400. Some of those lenses are a little bit better, for sure. You can actually get the same one in the public system for $100. You can also get something that will still work, that's still good, but you have options in the public system. In the private system, they're not going to tell you about those options. They're going to tell you about what you need, and it's going to have a price tag. So the other thing that Ford is saying is, it's not going to cost the public system more. Well, we know it is, and nobody's going to pay out of pocket. Absolutely, they are. There's all kinds of hidden fees that patients are going to be forced to pay, and they're going to be vulnerable. And who wants to tell their surgeon who's going to be performing a very delicate surgery on them, I don't actually want to pay you that money? You're left in such a vulnerable spot. So it's going to cost the public system more. It's going to take away our needed healthcare people, our resources, and it's going to cost patients out of their pocket directly.
Yeah, absolutely. One thing I'm hearing from constituents in my riding is that they are being told that it is a condition of attending a private clinic that they have to go with the more expensive lens. So your choice is to wait in the public system, or it's to take the more expensive lens that the doctor is recommending, pay out of pocket, and get your surgery right away. So there's some incredible coercion that's taking place at a moment when people are really vulnerable. And the other element, as you talked about, the less complex cases are coming out of the hospital, which is now left with just the complex cases. But the government is actually paying these private clinics more per procedure than they're paying the hospital. And the hospital uses the economy of scale of lots of procedures to pay for all procedures. And now they're losing those simpler ones where they might have made some savings that then pay for the more complex ones, and they just have the more complex ones for which they get reimbursed less from the government. So, it is absolutely going to put more pressure on our system. And when I speak to constituents who think, well, maybe this isn't so bad because I've been waiting a really long time and anything that gets me healthcare faster is good, they don't understand that they can be one of those cases that's rejected by a private clinic. You have no guarantee of service at these clinics. And so this could end up making you wait longer in the public system with no other alternative.
Thanks for adding on the economies of scale, Chandra. You're exactly right. When they cherry pick, it's left, the hospital system is left with the most expensive cases, to no fault of these people who require that help. But it creates a huge financial burden for our public healthcare system, who already can't afford to run operating rooms in the summer. It's just going to get worse.
Yeah, it's crazy. Thanks, Adrienne. Back to you, Joel.
Well, okay. I don't know about everybody watching this and listening to this, but I am fired up. This is ridiculous. It may be the coldest day of the winter out there, but it is angry passion that I'm feeling about this attack on our public healthcare system. Ed Cashman, Ottawa Health Coalition, you have been engaging in discussions with people around Ontario. Could you give people tuning in just now a sense of what they can do, what they can plug into in our city within, the next number of weeks? And Amy, sorry to put you on the spot, but I know you have some contract negotiations coming up soon. I want to make sure you have a time to explain to people what they can do to support the work you're doing. And Dave, same offer for you, just heads up for you coming soon. But Ed, over to you. You're in the organizing hub there at the Ottawa Health Coalition. Tell the good people of Ottawa how they can plug in to push back.
Thank you, Joel, for the plug. So it might be tempting as citizens to say, well, we'll just wait for the next provincial election. The truth is the next provincial election won't be till 2026. The Ford government will have a lot of time to do major damage to our healthcare system in the interim. So we can't wait for the next provincial election. There'll be a handful of by-elections, but that's not going to be enough. So we, the citizens, need to get involved and do things in our communities, because I think going into this, we need to be mindful what happened in the fall with the education workers. They, I think, set the bar very high, but they also created a bit of a roadmap for all of us to follow if we want to be successful in this. So let me share with you a couple of dates that we've got coming up that people need to be mindful of. So next Tuesday, here in Ottawa, the 13 provincial and territorial premiers are coming to town to meet with the Prime Minister. The sole item on the agenda is healthcare. And so the Canadian Health Coalition, in cooperation with the Council of Canadians, is organizing a rally opposite Parliament Hill at the Terry Fox Monument. we can get you information about that, but it's a great opportunity to come out and show your concerns. Send a message to Mr. Ford that, you're not happy with what he's doing. There's another opportunity. All spring, there'll be other opportunities. Joel mentioned the nurses are in bargaining, but OPSU is planning something in mid-February. CUPE's got something coming up. SEIU is going in on the 25th of March to 51 ridings, talking to people and talking to members of parliament to get them aware of what's going on. These actions by the unions are all intended to lead up to Ontario Federation of Labour Day of Action on the 3rd of June. So there's all kinds of stuff, but I want to bring it back to Ottawa. The 18th of February, which is a Saturday, we want to gauge the room here today to see if people are interested in joining us at an action outside one of those private clinics here in Ottawa that's slated to get the contract from the Premier. And so we'll have information for you on that as well.
Right on, Ed, right on, Ed. So we just do a tour de tab to Amy, Dave, and Melissa. Can you just add a little bit of context what Dave's saying, what your unions are doing and how we can support you?
Yeah, so that's great. So for us, we started yesterday. We had across the Ottawa Hospital because we're in negotiating right now with the Ontario Hospital Association, the central agreement. We had a sticker campaign. We started with that, getting all the nurses at the Ottawa Hospital to wear stickers showing support and unity, and just to engage the public, in conversation as to what's going on, increase awareness. February 23rd, we're going to be having some picketing at select sites. So not striking, but really just picketing to, same thing, raise awareness, engage people, and it's difficult because a lot of our members are working, but we really wanted to increase visibility and make the public aware of what's going on. And then March 2nd, we have some buses going down to Toronto for a rally outside the Sheraton, where in downtown Toronto, where the bargaining is going on, and we're hoping to shut down the streets of Toronto, and let our voices be heard. So as much public support as we can get, better. Really, speak to your MPPs, speak to each other. I think it's really important for people to talk and get the message out and let people know where they stand, and let your politicians know as well. So,
right on. Over to you, Dave. What's up with OCHU and CUPE?
Thanks, Joel. We've engaged our members all throughout the province, and we're really gauging where they're at. And, I think they are up for this fight. I think they understand that attack on our public system will only harm public in Ontario. We're proud to have joined a coalition with ONA and OPSU and SEIU and Unifor, and they presented at Queen's Park a united front standing up against privatization. We have in the works right now several rallies that are going to be kicking off, we're hoping in March into April, and leading up to what Ed said, an escalating action across the province. But we're in this fight, and we're in this fight to win it.
Right on. Melissa, over to you.
Yeah, thanks, Dave. That's great. Yeah, we're excited to be joining with the other unions in this fight against privatization, because it affects us enormously. And we're also, OPSU is celebrating February 13th. We have a rally for the 20th anniversary of the illegal walkout by OPSU members in 2003. It was allied healthcare members that walked off the job. And it's interesting because we looked back at the videos and they were fighting for wage increases, more staff, everything that we're fighting for today, they were fighting for in 2003. So we are doing a sticker campaign. We're having rallies at hospitals all across the province on February 13th. And it's wear red in support, and the hashtag is right to fight for that day. Just a reminder that we're not afraid to walk out if we have to. So I'm excited to see where that goes.
I wouldn't want to take you on, Melissa. That's for sure. That's a real gauntlet on the ground there, Ford government. If you're listening, I hope you are. Actually, I hope you are. Okay, I want to say a couple of quick things from an organizing perspective here in Ottawa, and then Chandra, I'll throw to you from what you're hearing in Ottawa Spain, just from Ottawa Center to Ottawa Stepien. So we have been hearing nonstop from neighbors who want to get involved, who want to know more about what's happening. And I think we've accomplished a lot on that front today, thanks to all the folks who are with us, but who have also been saying, we need to have, what is our local plan? So I think you've heard very clearly. Next Tuesday, if you have time at noon to meet at the Terry Fox statue, our friends from the Canadian Health Coalition are bringing neighbors together to tell the premiers and the prime minister that we need to protect public healthcare and we need adequate money for public healthcare. So that's your first opportunity. Your second opportunity, and this is a trial balloon Ed has floated out, I totally support it. I will be with Ed and anybody else who wants to gather at the intersection of Saint-Laurent and Industrial, where Herzig Eye Institute's office is. I think it's ridiculous that the government is handing 5,000 non-urgent cataract surgeries to Herzig without any tendering process, without any disclosure. And we know that they are going to be billing the public system at least 33% more. Elizabeth Payne from the Ottawa Citizen uncovered that detail for us. Thank you for your journalism, Elizabeth. We know that we're going to be paying more to be serving folks, as Adrian said, that are likely to be healthy and almost able to process. Before throwing to Chandra, I have to relay an anecdote from a pop-up office hour I had earlier this week. Someone came to talk to me at the Happy Goat Cafe on Laurel Street there in Hintonburg, who had worked at a private optical clinic. I'll keep the name out of it for now, but had worked at a private optical clinic for 4 years, processing 25 surgeries a day at significant cost. And the amount of training this person had to work in that clinic was 2 weeks. The job that was posted was for an admin assistant. The person I spoke to thought they would be processing paper, doing organizational work. That was expertise they had. They were told immediately they would be recalibrating laser machines and cleaning surgical equipment. The healthcare workers on this call know exactly the training one needs to do that work safely. 2 weeks. 2 weeks of training. Left that job out of the concern of safety, spoke to the presiding medical professional who ran that clinic saying, what do we do in an instance where we have some kind of complication? And that person said, well, that's why we don't take medically complex cases. We make sure those go to the hospital. That's what we're dealing with. That's what we're dealing with. Chandra, over to you.
I think it can't be repeated enough. Again, Herzig lobbied the government for this. There's a reason why it went to Herzig without a tender. This is part of a pattern with Doug Ford that he rewards people who lobby his party, who donate to his party with these opportunities for profit, rather than taking steps that will benefit all Ontarians. We've seen it with the Greenbelt and Doug Ford's approach to housing, which is also starving our municipalities of resources they need, not investing in any deeply affordable housing. But some developers are going to get incredibly rich from opening up that greenbelt and being able to build top-end housing that people who desperately need housing won't be able to afford. Doug Ford is telling us again and again who he is, somebody who doesn't have the best interests of Ontarians at heart. But there's another pattern that we have seen with Doug Ford, which is that he will back down in the face of public outrage. We saw it during the pandemic when he tried to shut down playgrounds. And my favorite example was in the fall when we saw it when he tried to strip education workers of their rights, tried to impose a contract on them that was less than what they were in the process of negotiating, tried to bully these incredibly hardworking, low-paid women. And they stood up to him. The public stood in solidarity and he backed down. And the important takeaway there was the solidarity, that the workers came out and stood together, unionized workers from across sectors, but also non-unionized workers with them, parents standing out there. I've never seen the kind of solidarity that we saw in those few days when they were out on the protest lines. People from all walks of life standing in support. And that's what we need to do now. So all of these protests, yes, they're being organized by different groups, but please come out to everyone, make your outrage at this decision known, stand together in solidarity, because it's going to be that kind of solidarity across union, across organization, people who've never been this mad and gotten involved in political activism before. It's us standing together that is going to make Doug Ford back down.
Right on, right on. Sandra has written in to us through the Q&A function on Zoom, which folks can do if you're tuning in, saying more publicity needed publicly, things like W5, documentary program CTV runs with broad reach and investigation, an outsider look. Sandra's writing can bring it home to people that it's not just unions or politics to complain of the problems of privatization. Sandra, I totally agree with you. And my challenge back to you would be share this video. Share this Zoom with everybody you know so we can get the word out. We have a few moments before we wrap up this afternoon. Again, I want to thank everybody, every single troublemaker here for being part of this because we've needed you. Final thoughts, clothing thoughts that you want people in Ottawa to know as we get ready to build a movement to save our public healthcare system. Anybody want to jump in? Adrian, over to you. And then Ed.
I sort of talked a little bit this morning about how this isn't innovative because this is where we started. And, I think that there's a lot there. We won this. We won public healthcare. We can win it again. They've tried to take it away from us many, many times, and we've beaten them back every time. And so this is no different. And Ford's a bully, but we've been up against even bigger bullies before. We got this. And so I'm really proud that people came together today. I'm thrilled to see the support that's out there. And I know that Ottawa's tough. So, it might be minus 42 outside. We're not out there today, but we'll be out there tomorrow and the days to come. And I'm excited to see you all out there too. Thanks for hosting this.
All good. Ottawa's strong. Over to you, Ed.
Thank you, Joel. I want to send a message to the workers on this call, the people that are the ones that are responsible for healthcare. And they're the 3 R's. Recruitment. Recruitment starts with retention. You got to keep the people you got before you go out looking for more. And retention starts with respect. And that's where the patients and caregivers come in. We have to show the workers the respect by fighting for our healthcare system, that we all do this together. Thank you.
Right on, right on. Elizabeth has posted in the chat that could we please post the event? So what I'm going to ask Ethan from our crew is, Ethan, if you wouldn't mind just listing the link from the Canadian Health Coalition for the event next Tuesday. And then I can tell you for folks who are tuning in from Ottawa Centre, our MPP newsletter is going to go out very soon after this call. Is going to feature all of the events that we are being discussed and more to come. But Chandra, over to you for how people can plug in and know more.
Yeah, if you're from Ottawa, West Nepean, I also have a newsletter. So make sure you follow that because we'll keep on sharing all these opportunities on social media as well. And there's some great people here to follow. Ed Cashman from the Ottawa Health Coalition, Melissa Conrad, also a powerhouse in her own right, Cupie and Ochu. So it's a great source of information about these events, and invite a friend. Invite 10 friends because it's going to be together that we're going to win this fight.
All right. Look, this never happens in progressive community. We are running ahead of time. This is how efficient and focused things get when you work with healthcare advocates. Okay. So want to flag that. Also wanted to flag one thing. Just hold on. I'm just going to grab something. When you come and see Ed and me on the 18th at the corner of Salana and Industrial, we will be bringing a wonderful creation by Velvet Leclerc, who made an ATM, because that's increasingly it would seem that Premier Ford is an ATM for very powerful people. And just to back up what Chandra said, these are the options, on the artist's ATM that Mr. Ford's created for Herzig. You could choose to destroy the Greenbelt, privatize healthcare, maintain 124. But there's one button, as Chandra said, that doesn't work anymore, Bill 28, because the pushback that everyone was involved in took that option off the table for Doug Ford. So let's see in the months to come if we can't take more of these options off the table for Mr. Ford. So I hope to see you, all of you folks tuning in on Tuesday, if you can make it noon at the Terry Fox statue, so we can send a message to the Prime Minister and the Premiers. I hope to see you on the 18th at Herzig, because the public deserves to know. Public deserves to know how much money we could be wasting, what this is going to do to our system. And for all of our friends from the Ottawa Health Coalition, from QPOCHU, from ONA, from OPSU, who are going to be engaging in work, we are going to make sure you know about it. And David, from the bottom of my heart, thank you so much for being with us today. It takes a lot of courage. And there's a lot of people in exactly your circumstances, and you should know that you can call Chandra and me at any point, and we're here to listen. We're here to help you and here to work with you. Thank you so much for tuning in. Struggle continues. Get out there and cause trouble. We need it.
Thanks, Joel. Thanks, everybody.
Bye, everybody.
Thank you, everyone.